morning, everyone. Thank you so much for joining us today. Thank you to Congresswoman McClellan, Secretary Walker, our friends at TCI, and other advocates and community members for joining us for this important conversation today. My name is Katie Baker, and I am the Virginia State Director of Protect Our Care. We are a national advocacy group whose mission is to strengthen and protect healthcare, and we do so largely through educational events like this one. I'm going to keep my remarks super brief because we have a very informative presentation today from our Deputy Secretary. I'm going to turn it over to her in a moment. But I just want to remind folks why we're here. Just over a year ago, Republicans in Congress, including every Republican in Virginia's congressional delegation, voted to pass what we at Protect Our Care just call the Big Ugly Law, because it cut $1 trillion from healthcare, from Medicaid, the Affordable Care Act, all to fund tax giveaways for the ultra wealthy. And states are paying the price, and Virginians are paying the price. So we're going to hear their voices today. And with that, I want to turn it over to Deputy Secretary Walker, who's going to offer a presentation with some of the latest state data on the impacts and response to this big ugly law. Deputy Secretary.
Thank you, Katie. And thank you to all of you for having me talk with you all today. Virginia has been all hands on deck working on implementing HR 1. So I'm going to share a brief presentation with you all today. Let that come on up. So just to talk through a little bit about what the legislation is doing and what the impacts are in Virginia. And then I'm going to talk just briefly about some of the mitigation activities that the administration is working on at the moment. So just to give a starting overview, it is not an exaggeration to say that HR 1, or the One Big Beautiful Bill Act, has made sweeping changes to the healthcare landscape in Virginia and the social services system. As Katie mentioned, the $1 trillion cut to the Medicaid program is the largest cut in the program's history. In Virginia, we were initially estimating that that would be about $1.8 billion to $2.6 billion per year in terms of lost federal revenue to the state. But what we are actually finding is now that seems to be a bit of an underestimation. As we are looking at the new proposed rules that are coming out of the federal administration in regards to implementing HR 1, what we are looking at now is about a $2 to $6 billion per year in lost federal revenue. And where that's largely coming from has been the proposed rules coming in terms of provider payments, as well as in terms of the exemptions for the Medicaid work requirements. So just to give you kind of a sense of what that means for our Medicaid members. So right now we are looking at about 300,000 Virginians who are currently at risk of losing their Medicaid coverage for the work requirements. That's out of about it's right now we have about 530,000 Medicaid expansion adults. So it's the 300,000. I'll talk a little bit more about who this population is, but it's about 300,000 people who are currently at risk of not being able to provide us the information to say that they are actually working. But as you all know, the HR 1 is not just work requirements. There are a number of different policies. So we also are looking at how many people are going to be losing health coverage based on their citizenship status, how many people are going to be losing their SNAP benefits, and at the same time that we are having to do a significant amount of investment at the state to be able to meet these new federal requirements, and are losing a lot of that federal revenue, we are having to invest significant state dollars to be able to get our systems ready and able to be compliant for the law in January. So to talk in a little bit more detail about what each of the different provisions really mean in Virginia. So as I mentioned, HR 1 is not just one thing, it's a number of different provisions. The very first one from the Medicaid front that is going into effect is changes in non-citizenship eligibility. So this essentially means that A number of our legally present non-citizens who have previously been able to have full coverage for Medicaid. So our asylum seekers, our refugees, people are here on either the Afghani or Iraqi special immigrant visas, and a number of other smaller categories. They will be losing their full benefit coverage come October. So our Department of Medical Assistance Services actually started sending notices out earlier this month. So at the beginning of the month, we started sending notices to these individuals to ask them to update us if our information is wrong. Right now, that looks like it's about 5,800 individuals who received those notices in Virginia. And then they will have through September to be able to update that information with us, tell us that their citizenship status has changed and there's actually new information. And then come the end of September, they will be disenrolled in October 1st if they do not meet the new required citizenships requirements. We are working on our outreach for that now. So individuals are currently in the process of being able to provide us that information. The next one that really is going to make a big impact on our providers is really the retroactive eligibility. This is going to be not just providers, but also members. But really what this is saying is that previously in Virginia, we allowed, if somebody found out that they were Medicaid eligible and had a bunch of medical expenses that they had over the last 3 months, we would pay those medical expenses. This is now being cut down to 1 or 2 months. So what that means is that our providers, our FQHCs, our free clinics, but also our hospitals and our primary care clinics who are often identifying people as being eligible for Medicaid, they will not have those costs reimbursed, and we are likely to see increases in medical debt as a result, as members are not being able to have their historical medical expenses covered. That goes into effect in January at the same time as our 2 big eligibility categories are also going in effect in January. So the one that everyone's been talking about is work requirements, and I will talk a bit more about that. But the other one that I will say that I think is a very difficult one to estimate what the actual impact will be, but I think will be incredibly impactful on loss of coverage, is the 6-month redetermination. So right now, people are required to renew their eligibility every year. That is now going to be changing for our expansion adults, and they're going to have to come and tell us every 6 months that they continue to be eligible. I think adding that additional step is likely to result in missing many people who are likely continuing to be eligible, but are not taking that step to come reach us. And so we are doing everything we can on our end to try to automate as many processes and streamline as much as we can. But that administrative burden is likely to result in significant coverage loss. And we're just mitigating the harm at this point to try to streamline what we can. The work requirements piece is clearly an area where we have concern that there will be loss of coverage. So we are working right now based on the guidance that we have been getting from CMS to understand exactly who will be exempt from that requirement and who will be considered to have met it. And that is where that 300,000 number comes from. The data that we have right now, we know that we can identify about 200,000 individuals from our Medicaid expansion population as already meeting that requirement or knowing that they have an exemption. At this point, those additional individuals are going to have to provide us some additional information so that we know whether or not they meet the requirement or not. And then we're going to continue to work on the back end to use as many different data sources as we can to try to identify people who may already have some of those exemptions and may continue to be eligible for Medicaid. I'm not going to go too much into the provider payment piece, except to say that there is new rules coming out on this. So there was a new rule from the federal administration on the state directed payments that has already come out. The provider tax proposed rule more recently came out. Those rules are increasing the estimations for the state on how much federal funding we would be expected to be losing and what the expected payments would be for our Medicaid providers. The Joint Commission on Healthcare, this is an organization that's a legislative committee in Virginia just completed a report that basically said, as a result of what they are seeing, and this was even before the rule came out, but what they were seeing from just the initial legislation of HR1 was that we have about 9 hospitals, especially rural hospitals, are at immediate risk of closure. So this is something that we are going to be keeping a close eye on. And then just to walk through what we are doing on the administration to try to make sure that we are mitigating harm and reducing barriers to access to care. We've been doing a number of things. So we have been joining multi-state litigation on the work requirements. We have also been partnering with our congressional delegation to make sure that they are continuing to be informed about what our impact is. And I'm sure you will have some of that from Congresswoman McClellan today. And we've been really grateful for her partnership on this. And I will say we also have invested over this last year about $500 million in different ways to try to address the uncertainty in the federal landscape. And one of those main pieces is that we've created a $150 million new state subsidy for individuals to be able to access coverage on the marketplace. We know that we are not going to be able to capture everybody who has insurance loss on that state marketplace, but we do believe that this state marketplace is going to be a huge way that we can continue to make coverage affordable in Virginia. And then lastly, as I mentioned, we're working very hard with our teams and the agencies to be able to streamline the administrative burden that may be coming and to try to use our data as much as possible and limit all the paper that people are going to have to be sending us. We do have some dashboards that I will show you as well to show you how we are trying to be transparent with our partners so that our partners can plan as well. That's been a critical step for us as we are very closely working with public and private partnerships so that they can work with us hand in hand to make sure that at the very local level, we are bringing all of the resources together that we can to fill any gaps that we at the state might not be able to fill by ourselves. And so being able to be transparent with that data has been really critical. This is just an example of the data dashboards that we've been putting together. This shows you the members who are at risk of losing coverage, who are kind of newly subject and at risk of losing coverage due to work requirements in both Medicaid and SNAP. What I will say is that while you see the purple areas are in our urban areas, because that's where the volume is of our Medicaid members and our SNAP members, when you look at the orange and blue areas down, for instance, in Southwest Virginia and in Southside Virginia, while it may not be the volume, and so you may not have quite as dark of a number, what we are seeing is that it could be as much as 20 and 25% of the adult population in those areas. So even though the volume might not be as high, proportionately, the impact is going to be very high in some of our more rural areas. Ultimately, the Spanberg administration is committed to doing what we can to make sure that people who continue to be eligible continue to be enrolled in Medicaid and our SNAP programs. We've been working very closely with our partners across the Commonwealth to make sure that we can mitigate access to care barriers to the extent possible. But as we know that this is a very impactful bill, and at this point, we're really working with all of you all and whoever we can to partner to make sure that we are protecting care for our Virginians. And with that, let me stop and send it back to you, Katie.
Thank you so much, Deputy Secretary, for that very informative presentation. Thank you for everything that you and the whole Spanberg administration are doing to make sure that we're not letting folks slip through the cracks who are still eligible for Medicaid and the Affordable Care Act. And huge shout out to you all, as well as to Democrats in the General Assembly for that ACA premium support program. I think that's really amazing lift, and we'll get a lot of people hopefully back on that marketplace. And with that, it is my honor to turn it over to Congresswoman McClellan, who was the sponsor of legislation to create the ACA marketplace when she was in the state Senate. And also just want to remind reporters, if you have questions, please just go ahead and drop them in the Q&A now, which will save us some time at the back end. Congresswoman.
Thank you, Katie. Thank you, Protect Our Care, for convening this very important conversation with Deputy Secretary Walker and her team, and that presentation that presents a pretty bleak picture of the healthcare safety net in Virginia once the big ugly laws, Medicaid cuts take effect. Now, as you heard, as a state senator, I was proud and excited to vote to expand Medicaid back in 2018, because then, as now, Virginians all across the Commonwealth, whether they were urban, rural, or suburban residents, they wanted to know that they could get the health care that they needed when they needed it without going bankrupt and without having to drive for hours to get that care. And expanding Medicaid to hundreds of thousands of Virginians helped to meet that goal by closing the insurance gap and making sure that they got the coverage that they needed. And to this day, I hear constituents, not just in my district, but across the Commonwealth, talk about how important Medicaid is to them, whether it's helping them to get home care, contraception, dialysis, dental care, cancer screenings, regular checkups. Medicaid has made health care more accessible and more affordable to more people and connected more people to medical homes so they could get the care that they needed before it was an emergency or before it became acute or critical. And Medicaid reimbursements for that care had been the difference between staying open and providing a full range of services to patients, or in our rural areas, or those rural providers closing their doors. But soon, the worst impacts of Donald Trump and congressional Republicans' big ugly law are going to take effect in January of 2027. Some impacts are already being felt. And the provisions, the eligibility changes will impact the very people that we fought to get covered in 2018, the expansion population. Now, many of the people that are going to be impacted by these cuts are the very same people that are being impacted by the SNAP benefit cuts. And so they're going to face increased food insecurity at the same time that they're going to face a harder time getting access to the health care they need when they need it. So it's really a double whammy. And this is really a tale of two different cities. What Richmond did in 2018 to expand Medicaid under the Affordable Care Act, and now what Washington has done to rip that health care away from millions of Americans. So under Democratic leadership, including those in Congress and former President Biden, Virginia saw a record 93.6% insurance rate in 2023. That meant more people could afford to pay for that doctor's visit, those screenings, that dialysis, that preventative care, without having to make difficult decisions between paying their rent, paying for food, or paying to get that cough checked out. And thanks to President Trump and my Republican colleagues in Congress, 300,000 Virginians are at risk of losing their Medicaid insurance, on top of the 100,000 people who have already lost their Affordable Care Act insurance because they were priced out of being able to pay for the premium when the Republicans let the enhanced premium tax credits expire at the end of 2025. Now, why did they do that? Why did they put the largest cuts to healthcare and food assistance in American history in place in that bill? All to make permanent tax credits and put more money in the pockets of billionaires, and in one case, a trillionaire, on the backs of hardworking Americans who rely on Medicaid for their health insurance and SNAP for food security. Now, while I am fighting to fully reverse these cuts at the federal level, I am grateful that at the state level, Governor Spanberger's administration and the General Assembly have taken steps to try to mitigate the damage these cuts are going to have on Virginians. Virginia state legislators included millions of dollars in outreach and workforce development support in their budget. So Secretary Figueroa and Deputy Secretary Walker have hit the ground running, holding public forums and helping educate everyone across the Commonwealth about the upcoming changes to try to help them stay covered. And my team and I have offered our assistance in that after we held a roundtable with the Secretary to hear just how these cuts are going to impact Virginians. So I appreciate all the work that is being done at the state level. But whether you get access to care shouldn't matter what state you live in, and whether you have a governor and a General Assembly or a state legislature that are doing everything within their power to keep their citizens covered. We need to make sure that we are taking steps at the federal level because we've already seen, even before the cuts fully take effect in January, we've already seen rural providers close their door or eliminate certain provisions, like the hospital in Lynchburg that got rid of their labor and delivery department. We're seeing that more and more. My conversations with healthcare safety net providers, they are stretched beyond the breaking point. And again, all of this not happening in a vacuum. It is happening with cuts to food security, food assistance. We see demand for that increasing. We see many, many more Virginians who are struggling to choose between paying their rent, paying for healthcare, paying for childcare, paying for their electric bills, paying for food. They need relief. And we are doing everything we can to make sure we reverse these cuts at the federal level, and are grateful for the state doing what it can to mitigate the damage. With that, I'm going to turn it back over to Katie.
Thank you so much, Congresswoman, and thank you for everything that you have done and are continuing to do to sound the alarm. You did so many events last year before this bill passed and after it passed to try to educate people about what those cuts would mean. I know you went all over the Commonwealth, so we're really just thankful for your leadership. And next, I'll turn it over to my friend and colleague, Rodrigo Soto from the Commonwealth Institute for Fiscal Analysis. Rodrigo.
Thank you, Katie, for inviting TCI to join today's conversation. As mentioned, my name is Rodrigo Soto, and I'm the Legislative and Campaigns Director at the Commonwealth Institute for Fiscal Analysis. And we are a research and advocacy organization committed to advancing racial and economic justice in Virginia. All that to say, protecting and strengthening Medicaid is essential to our mission. Medicaid is particularly important for Black people in Virginia because Black Virginians make up 34% of Medicaid enrollees, despite making up 18% of the state's population. So therefore, cuts to Medicaid fall more heavily on Black families who rely on Medicaid in order to access affordable health care. And at a time when the cost of living continues to skyrocket, protecting people's access to Medicaid is more important than ever. Unfortunately, Republicans in Congress had other priorities last year when they passed the disastrous reconciliation bill, HR 1. Instead of working to lower the cost of health care and food, congressional Republicans voted to gut Medicaid, the Affordable Care Act, and even SNAP. By the numbers, Republicans in Congress cut over $1 trillion in healthcare spending when combining the Medicaid and ACA policy decisions, along with nearly $187 billion in SNAP funding. And while I say these healthcare and food assistance cuts, usually say that these healthcare and food assistance cuts have gone to line the pockets of billionaires through tax giveaways to the ultra wealthy, I do want to note that beneficiaries also include someone who was temporarily a trillionaire this year, Elon Musk. And while Mr. Musk may have lost his trillionaire status and gotten back to just being another billionaire, I'm sure nobody here would argue that he is struggling to make ends meet. But the families who rely on Medicaid are struggling. Rising gas prices, astronomical childcare costs, and overwhelming housing costs disproportionately impact the same families who are now at risk of losing their health care. But thankfully, state leaders in Virginia have taken action by passing a budget that includes $3.5 million for education, outreach, and workforce training support, $10 million for our free clinics, $5 million for our federally qualified health centers. And this is particularly important. They reversed proposed cuts by former Governor Glenn Youngkin to famous prenatal for certain immigrant communities. And that last part is particularly important, as was mentioned before, because HR 1 will restrict Medicaid access to certain lawfully present immigrants. So we're incredibly thankful for the team at HHS, including Deputy Secretary Walker, for going above and beyond in their efforts to mitigate the impacts of HR 1. And we're also equally grateful for Congresswoman McClellan and many of her colleagues for fighting to reverse these healthcare cuts at the federal level. TCI is deeply committed to working alongside our state and federal healthcare champions to make healthcare accessible and affordable to all. And with that, I will pass it back to Katie.
Thank you so much, Rodrigo. Thank you for all the advocacy that TCI does, particularly for marginalized communities. And thank you for just joining so many of our Protect Our Care events. And with that, I know we've talked about a lot of data today, which is really important, but when we're talking about those 300,000 people who are at risk of losing their Medicaid, I think it's really important that we're highlighting their individual voices and stories. And with that, I'm going to turn it over to my friend and colleague, Julie O'Brien, Julie of Richmond.
Thank you, Katie. First of all, I want to say thank you to Congresswoman McClellan, Deputy Secretary Walker, and Protect Our Care for putting together this event. I think there's a lot of value in still having virtual events as it allows for greater accessibility for disabled and immunocompromised folks who are at an even greater risk due to the Medicaid cuts in HR 1. For me, Medicaid has been a game changer. Growing up, I had a lot of health issues that led to me missing a lot of school. And fortunately, I had good insurance through my parents. So I was ultimately able to work with my doctors to find a good combination of medication. I rely on those medications to live a normal, fruitful life. And for the past 4 years, I've been on Medicaid, and my copay has been $0. But now, because of HR 1, I'm not sure how much longer that'll last. The work reporting requirement in particular seems like just another excuse to put a wall between me and my healthcare. Right now, I have a full-time job, but for most of my 20s, I was underemployed. I relied on gig work. It varied drastically depending on the season, and I know a lot of other people in that situation, plus others who are in school or are caretakers or who just can't find full-time work. And even now, in my full-time role, I work for a small business, and I love my job, but our profit margins are really thin. And if we have a bad couple of months, I could lose my job or have my hours cut, and I would no longer meet the work reporting requirement. So it seems to me like the federal administration that pushed for the work reporting requirement is deeply out of touch with what the reality looks like for the average worker. Since the passage of the Big Ugly Law, I've been preparing to lose my Medicaid. I tried going off of my oral contraceptive to see if I could save some money there, but ultimately my PMDD symptoms are debilitating, so I had to go back on it. I actually had a doctor's appointment yesterday to talk about how to manage my care if I lose my Medicaid, and ultimately, I shouldn't be doing any of those things. I shouldn't be going off my medication to save money or talking to my doctor about how to cut corners. My medical decision should be based on medical science, not politics. What bothers me the most about all of this, I think, is that the government chooses its priorities in how it spends our tax money. So when it comes to taking care of its constituents, Republicans in Congress and the Trump administration do not care who they're hurting. They want to spend that money to give it to tax cuts for billionaires and an unpopular war. So thank you to Congresswoman McClellan and Deputy Secretary Walker for all you're doing to help people like me keep our health care. And thank you to Katie for giving me this venue. And I'll turn it back to you.
Thank you so much, Julie, for your willingness to share your personal story. Thank you to Congresswoman McClellan, Deputy Secretary Walker, and Rodrigo. And with that, I want to turn it over to Fletcher to manage the Q&A. Looks like we have one question from a reporter in the Q&A box. If any other reporters have questions, please drop them in the Q&A box. Fletcher.
Thanks, Katie, and thanks again to all of our great speakers. We have a question that came in from Greg Schneider at the Washington Post. Deputy Secretary, maybe we can start with you here, and then Congresswoman, if you want to join in, feel free. What impact is the Federal Rural Healthcare Transformation Fund having? Is that $189 million alleviating any problems, or how is it being used?
Thank you, Fletcher, and thank you, Greg, for that question. I think it's a really important one. So as part of HR 1, there was this Rural Health Transformation Fund. In Virginia, we received $189 million as part of that. To be clear, we are thrilled to have that investment for the rural health communities in our Commonwealth. That said, 189 million just does not combat $2 to $6 billion. And so while, yes, we are thrilled to have those funds coming into the state, specifically, we're working on 4 different main buckets that we are spending those funds on. So we're looking at technology and interoperability, connecting people to technology so that they can have access to care. We're looking at working with our workforce. We're looking at kind of hybrid clinics so that we can have different provider types come into our rural areas. Those are all incredibly powerful investments. At the same time, part of the reason that we're having to do them is because hospitals are closing in those communities, and we can't use $189 million to stand up hospitals in rural communities. And so we are working through those investments, and they're going to help us mitigate some of the harm. The economic harm from losing a hospital in a rural community is beyond just the healthcare needs and the healthcare access. Businesses don't want to move into communities that don't have hospitals. Businesses don't want to move into communities that don't have maternity access. And so that's the situation that we find ourselves in now, while at the same time, we are using that 189 million to be as purposeful as we possibly can be within the restrictions of the grant and how the grant is structured.
So I couldn't have said that better. It just simply isn't enough. And I want to sort of put an exclamation point on what would happen in rural areas if these hospitals close. So take the Emporia Greensville area. There's a hospital there in my district that is one of those that have been identified as at risk of closing with these Medicaid cuts. They've already, that region, that Emporia has already lost 2 major employers. If they lose their hospital, I don't know how those 2 localities, Emporia and Greensville, make it. At the same time, remember the patients that rely on these hospitals, many of them are our farmers. I just did a roundtable with some of the farmers in the south side of my district who they themselves are struggling and barely able to make ends meet. Now, then on top of that, you take their hospital away and they don't know what they're going to do as they're trying to meet the costs of everything with very few markets to sell their products. So you can't look at these Medicaid cuts in isolation. And investing money in technology to have more telehealth in our rural areas is good. But at the same time, the Trump administration changed the rules for the BEAD program and delayed further being able to close the digital divide in many of our rural areas. And so not all rural areas are going to be able to benefit from that. And so that fund is just simply not enough to fix the damage that is caused by these cuts.
And I can just add one other thing just to contextualize Greg's question in the broader funding piece. The $50 million fund is very much a drop in the bucket. It's kind of like a Band-Aid on a bullet wound because $50 billion is not enough. It's a little over a third of the estimated cuts to Medicaid in rural areas. So rural communities are estimated to lose $137 billion over 10 years. So not only is this $50 billion fund not enough, it's not even recurring. It's a one-time fund. And these Medicaid cuts are permanent unless they're reversed. So it's very much a shifting the cost to the state because then state governments have to make up for that by, as I was mentioning, the free clinics and FQHCs. They're the ones who are going to be the last line of defense for people to get preventative care because that's going to be the only thing stopping them from getting the care that they need or just ending up in an emergency room that might not even be in their city because their rural hospital may have closed. So now they have to go another locality away. So it's a really big cascading effect that we're seeing, and the Rural Transformation Health Fund is not enough to meet the needs of rural communities that are going to be devastated by these cuts.
Thank you all very much. We had a pre-submitted question for you, Deputy Secretary Walker. What would you find to be the most concerning data point you've shared today when it comes to loss of coverage? And is there anything that Virginians can be optimistic about when it comes to healthcare?
Thank you for that question. I'm living in these data points every day. And so every day I'm concerned about every single one of these. I will say one of the data points that I didn't mention, we are now more and more hearing from our free clinics and our FQHCs that they have no more than 10 days cash on hand. And so I think when you add that to add the list that I was showing you about the hospitals that are at immediate risk of closure, even the people who have coverage aren't going to have anywhere to go if we don't have clinics that can keep their services open. And so that's a data point that I'm really concerned about and really working towards every day. The coverage piece, I think to Julie's comments, a lot of what we're looking at with that 300,000 are people who need coverage. We don't even necessarily have the information on why, especially if they're a new Medicaid enrollee, but they have some sort of disability that they have recently been diagnosed with. And now we're trying to figure out how to make sure that they can get the coverage that they need. And that work requirement can be really impacting their ability to get that coverage. So those are the populations that I'm really thinking about in terms of the coverage piece. What I would say for the where's their hope, one, I think there's hope, and there are people that are excluded from this, to be clear. And I want to make sure that that message is clear too. If you are pregnant or 1 year postpartum, this isn't you. If your child, like if you're losing coverage, but you still have kids on coverage, your kids can continue to get coverage. And so I want to make sure that people are hearing that message as well. But what I'm really seeing is the incredible partnerships all across the Commonwealth who are coming together to try to solve these really tough problems. Our FQHCs and our hospitals are working extremely closely together. That's not a partnership we are historically used to seeing. Same thing working with our Medicaid, our managed care plans. They're working extremely closely with all of our clinics. The partnerships that we are seeing come out of this are incredible, and it truly has been an all hands on deck approach.
Great. Thank you very much, Deputy Secretary. And Congresswoman McClellan, we had a pre-submitted question for you as well. What are you hearing from your Republican colleagues in Congress about why they voted for the big, ugly law? Do you think that any of them would support reversing these cuts now that their constituents are starting to lose their health care?
Well, I would like to think that they would support reversing the cuts, but there's legislation right now to do that, and they're not supporting it. They're not co-sponsoring it. They haven't signed a discharge petition to get it to the floor for a vote. And so, you know, they claim, Rob Whitman in a panel before we voted on the big ugly law said that this was all about eliminating waste, fraud, and abuse, but it's not. He said it was about trying to get the debt under control, but the big ugly law also increased the debt through these tax credits to billionaires, and in one case, a trillionaire. And so it is their constituents that are being harmed as well, whether it's, particularly in the rural areas. And yet they're not doing anything about it. Now, a couple of them, Jen Kiggins at least talked a good game about expanding the enhanced premium tax credits and supported that. But again, voted for the largest cuts to Medicaid and SNAP benefits in American history at a time when their constituents are going to be disproportionately harmed. Because again, let's go back to what I said about hospitals that are closing or hospital services. We have maternal health deserts in their districts. And now you have labor and delivery departments closing in their districts so that pregnant women, even though they have their Medicaid, they're going to have to drive even farther to have their baby. And in some cases, particularly in emergency or in a preterm birth, that could be the difference between life and death. So we've given them every opportunity to join us in reversing these cuts in the 119th Congress. They haven't done it yet. So I can't explain why.
Thank you very much. Those are all the questions we have for now, so we'll turn it back to you, Katie.
Thank you so much, Fletcher. Thank you again to the Congresswoman, the Deputy Secretary, and all our speakers. I don't see any more questions in the chat. I think we've had a really good conversation today. If any reporters have additional questions after this call, please feel free to follow up with me. Thanks, everyone.